Most doctors are wrong about how they treat plantar fasciitis. You don't have to suffer in pain. Their solutions are wrong and they're incomplete. In this video, we're gonna dive into the top 3 mistakes. Number 1 is just going to a podiatrist. A podiatrist has 5 tools. They can give you pills, they can do injections, they can put you in a boot, they can give you orthotics, or they can do surgery. That's the 5 things that they can do. A lot of those aren't long-term solutions. So some people get short-term relief, but they don't get the long-term solution. We had a client that came in that had 30 years of plantar fasciitis. We fixed it in 4 sessions. And I tell them to stop telling people that because that's not normal. That was a really quick progression, but we go about it a totally different way, and you're gonna find out all that information in this video. Number 2 is treating the site of pain. A lot of videos are online. They want you to treat the site of pain. So plantar fascia, right? I'm gonna step back and you can see it. The bottom of my foot. A lot of times it hurts right here, sometimes on the inside, sometimes on the outside, but really here in the heel. In classic plantar fasciitis, it hurts first thing in the morning when you get up. It's like Velcro ripping. That's really classic plantar fasciitis. But they also have pain later in the day when they've been walking around for a consistent period of time. They're getting beat up because of the root cause. That's what's making it worse throughout the end of the day. So when we're looking at fixing plantar fasciitis, the first 2 weeks, we do not want to go to the site of pain. That's where you have damaged tissue. So if you take a lacrosse ball or a tennis ball and you're digging out the bottom of your foot, you're just re-aggravating that. And then there's a lot of solutions that they want you to stretch it, just stretch it. The bottom of your foot, stretching your calf, but we're constantly pulling on that tissue that's damaged. It's like a frayed rope like this, right? The rope's not totally connected, and we're just pulling it apart all the time. And so your body's constantly going through this inflammatory process, and we're building up inflammation. It never gets a chance to cinch up and actually do the healing. Number 3 is not understanding the root cause of plantar fasciitis. Before we dive into that, make sure you hit the subscribe button and make sure that you leave a comment. If you want us to go through a step-by-step process of exactly how we fix it here in the clinic, we'll make that video for you. Leave a comment, subscribe, and make sure that you get a notification. You gotta hit the notification bell, and we'll make sure that we get that video out to you so you can actually fix this from your own home. The root cause of plantar fasciitis is that your foot is doing too much work. It's not designed to do all the work while you walk. So when we're looking at the leg right here, we need 50% of force production from the hip. So that's called triple extension. So when I'm walking or running, I'm pushing off of my foot, I'm pushing off with my knee, and I'm pushing off with my hip. I've got to do that all at the same time. And the beautiful thing is when you're born, you just do that naturally. We learn how to walk and we use our glutes all the time. What happens is over time, we're in school all the time, then we go to college. Depending on how long you stay in college, it dictates how long you spend at a desk and actually sitting for long periods of time, which ultimately is the biggest problem, is that we sit for so long, our hip flexors tighten up, and that doesn't allow our glutes to fire really well. So there's something called reciprocal inhibition. It's like, if I flex my bicep as hard as I can, my tricep has to be loose. If I'm sitting for 10 hours a day over 5 years, 10 years, then I'm laying down collagen, I'm laying down tissue in my hip flexors. So if my hip flexors are tight all the time, I can't fire my hip extensors. And we see that all the time here at the clinic, is that people aren't able to fire their hip extensors, their glutes. So then the next step is that they're gonna have to use other muscles. Our body's a compensation machine. It's actually amazing. You're gonna be able to get done whatever you need to be able to get done, but it's gonna compensate, and over time that creates these injuries, especially plantar fasciitis. Plantar fasciitis is a chronic injury. It ends up plaguing at least 10% of the population, but it's a huge influx of clients that we have every year that are dealing with years of plantar fasciitis, and we fixed every case by going about it this way. And that's why I know that we're gonna be able to help you in this video if you understand the root cause. So when I do triple extension, so I'm walking or running, I'm pushing off of my ankle, I'm pushing off of my knee, and I'm pushing off of my hip. I need 50% of that force production. I need it to come through my hip. 25% at my knee and 25% at my ankle. That's just a simple way of looking at it. But if my glute's not firing really well, I haven't activated those muscles, partly because my hip flexors are so tight, then I'm getting more force production from my ankle. And what we see with these cases of plantar fasciitis is that they're getting 50% from the ankle and the foot. So they're just whipping their foot and the butt never fires. So when we look at the model right here, this is the biggest muscle group in the body. This is the gluteus maximus, gluteus medius. These muscles together are the biggest muscle group in the body. And so our force production has to come through our hips. If you look at a defensive lineman in the NFL, their butt is enormous. You can set a cup down on it. I mean, it's like this, right? So that's where their force production is coming from. To run through somebody that's 350 pounds, you've got to have a lot of power. And that power comes from the hips. But just normal people like us that are working desk jobs, we lose that power coming from our hips. And if you're 70 or 80 years old, it's even worse. We've got to make sure that we're waking up those muscles, because we're never going to fix plantar fasciitis if we don't start getting force production up the chain into these bigger muscle groups. Because you can beat up on that tissue, grind into it, we're irritating it, but also we're still gonna walk and we're still gonna whip the foot, and it's still doing too much work. So the glute right here has to be fired up. And so that's what we do in the first 2 weeks. What's really amazing is when we have a client coming in, we haven't even touched their foot, and they'll have 50 to 80% improvement in the first 2 weeks. We haven't even touched their foot. All we did was really focus on getting that force production coming from the hip, and that's gonna get you long-term results. So get that force production coming from the hip, and then making sure that we're loosening up this chain going down the leg, because anytime we're thinking about muscle tissue and fascia, we should really think about it like a spider web, or because it's a spider web around our body, it's webbing. Do muscles move bones, or do bones move muscles? Muscles move bones. So if those muscles are tight all the time, then they're constantly having tension on them. We see these Achilles tears and plantar fasciitis so often. It's because we're not getting enough from the glutes. So we've got to start there, make sure that we're getting more activation here through the glute, my glute, and this guy, we'll call him Bill, his glute. It's got to be fired up. So first 2 weeks is a really serious focus on firing up these muscles, which we talked about earlier. If your hip flexors are tight, which you can see on this model, if these hip flexors are really tight, there's one right here, there's one right here, there's one right here. If these are really tight, they don't allow the glute to fire. There's no amount of exercise or stretching that you can do to loosen that up unless we're actually digging out the tissue as well. And that's what you'll get in the video. The subsequent video, if you want us to do it, we'll show you exactly how we loosen up the front side of the hip, loosen up the back side, and then fire up the back side. And we gotta loosen up both sides and then fire up the back side. We have to do that consistently. If you want long-term improvement, this is the way to fix it. So after 2 weeks, we'll start introducing something we call the ankle trio, where we start loosening up the tissue on the back side of the calf, so we get that pull to take away, because this is a chain of tissue. When you look at the calf coming up, it crosses the knee right here. When you look at the hamstring, it crosses the knee. So this is like two ropes. They cover each other and they get stuck together. So we've got to loosen that up in the muscle bellies, but we also got to loosen up where they're cross-secting. And that's going to take a ton of strain off of the bottom of the foot. So a lot of your treatment and a lot of the thought process of how we fix this problem has to be away from the foot. So first 2 weeks, we don't even need to touch the foot. We got to get the glutes fired up. The second 2 weeks, so it's week 3 and 4, we're loosening up the back side of the leg. And then 5 and 6, we're actually getting down into that area of the foot where you're having pain, and we're digging out that tissue to make sure that it lays down. Because when you have plantar fasciitis for a couple months or a number of years, what happens is your fibers lay down like in a cross fiber position. They don't glide across each other. And so they're just more susceptible, and they're weaker. They're more susceptible to tearing over and over. So remember, the number one problem that creates this is sitting, because it turns our glutes off. We've got to turn the glutes back on, fire up those glute muscles, And then we have to loosen up the back side of the leg. And then we have to make sure that we're loosening up that tissue in the foot. And that's the complete process of fixing it. We'll do a deep dive. Subscribe, ask us questions, let us know exactly where you want us to go with this content. We're here to help you. We'll see you in the next video.